implementing Medicare Wellness is really setting the framework for team-based care in a sustainable model long-term, which is going to be important in the future for surviving in a value-based payment environment. But back to Medicare Wellness, what we were able to do very successfully is educate the physicians on what their role really needed to be in the office visit, and then share the same kind of education with the clinical support team, the medical assistant, for example. They can spend the first 30 minutes of the office visit going through the health risk assessment with the patient. They go through the whole questionnaire and answer every question with the patient, and they document in the electronic medical record. The physician then comes in at the last 10 or 15 minutes of the visit and goes over the results of the assessment and hits on the high points, the things that they need to review. If they're, for example, advanced directives, or if there's something, maybe an indicated chronic disease state that's otherwise undiagnosed. The physicians can spend time with the patient going over that stuff, but the majority of the visit is done by the medical assistant. And in fact, what we did in our world was create a separate schedule template for the medical assistant to see these patients, and then the doctor would be piggybacked on those visits, so that there are really two separate schedules, and that is so that the medical assistant can spend the allotted 30 minutes with the patient, and then the physician can follow up in their schedule. So it's coordination of schedules, and it's coordination of care through the care team. What's really key in this is that everyone wins in this situation. So the patient is happy because they get in, they get their health risk assessment, they really have a clear understanding of the additional things like the directives, and if there's any care that they've missed over the past year or even longer if they've not been in. They have maybe asymptomatic undiagnosed disease states that they become aware of, and it becomes part of the care plan. The care team, whether it's the RN or the MA, they're happy because they're working at a higher level of their licensure to provide care to patients rather than just taking vitals and rooming patients. They're very satisfied. And the doctors ultimately are satisfied because the staff are and the patients are. And then the revenue side of this, which really can't be overlooked, because this isn't a service that Medicare expects anybody to offer for free. And what we hear a lot in resistance is, I just don't have time in my schedule to see these patients. That's what the doctors tell us. So if they structure them the way we recommend, which is 30 minutes with the medical assistant and 10 or 15 minutes with the physician or provider, it could be a nurse practitioner or a physician assistant as well, they get paid $170 on average for these visits. For these Medicare Wellness visits, which is significantly higher than they would get for the 99215, which is the highest level of routine office visit. They get paid significantly more for it, and they spend 30 minutes less with the patient than they would in a routine office visit. And the other thing is that's important to know from not just a revenue perspective, but really from a compensation perspective, most physicians are paid based on work RVUs, and the work RVUs are significantly higher for these wellness visits. So the physician will get about 2.4 work RVUs for a Medicare Wellness visit versus 1.5 work RVUs for a routine office visit. And again, the difference in time, they spend 45 minutes with a patient and get 1 full RVU less than they do when they do Medicare Wellness, and they spend only 10 or 15 minutes with the patient. The care team then builds trust with the patient. So when the patient encounters the care team other than the physician, they have a relationship with that care team and trust that they are speaking on behalf of the physician.